Good morning, FIU. My name is El Panye Hudson, and it's my honor to serve as the Senior Vice President for Human Resources and the Vice Provost for Diversity, Equity, and Inclusion. I hope you enjoyed that video. We want to thank our teams who've been on site and working this entire duration of our depopulation, and we have been keeping operations going with excellence and taking care of our students as well as our university community. So that was a special shout out to our university police, facilities, housing, Graham Center, MBUS, faculty health, the COVID testing site, all of those that have been right here, making sure that all has been going completely well. I'm again coming to you live from my office to your office or wherever you are at this time. It's been a week since our last webinar, and many might be saying, why are you doing this again so soon? I'm glad you asked. We had such a good time with such good questions last week. We wanted to reconvene and answer questions that didn't get answered. We wanted to over communicate some of the recurring themes and then provide some new information that we'll need your engagement in. So I hope you and your families are well and are appreciating our South Florida weather. Our hearts go out to the residents of Texas and the several places around the nation that are experiencing unprecedented degrees of weather. If our OEA director was speaking with us today, she would say this: find those things that we can be grateful for and focus on them because there's strength and gratitude. So before we get started, I want to go over a few housekeeping rules, just so you'll know that today's going to be just a little different than last week in some ways. Today's presentation is a webinar that's being recorded. It's going to be available later on news.fiu.edu. We won't have a panel of speakers. However, the president and I have an army of incredible professionals on ready to answer questions that you may have about our repopulation efforts. I'm literally going to be discussing the themes that we've taken from the questions posed during last week's webinar and sharing some responses along with members of our team. Additionally, we will take questions that you have today. We'll answer them live while other team members might be answering questions in real time through chat. So if we should run out of time, perhaps, and not get to all of them, don't you worry. We'll get answers to your questions to you, okay? So we're looking forward to another enriching discussion today. And without further delay, I want to introduce our incredible leader, President Mark B. Rosenberg, to offer greetings and remarks. You're on mute, Mr. President.
Yeah. Good morning, El Panye. I want to thank you and everyone who is engaged and watching today. We're so grateful for all that you have accomplished, and we're very excited about what's ahead. My goal today is to listen and learn. What you have to say is very important. We want you to know that we hear you, we see you. We're thinking about how best to meet the challenges that we have ahead of us, and you count in all of this. So I'm here to listen and to learn and to help if I can. Thank you, El Panye.
Thank you so much, President Rosenberg. So let me say this to all 900 plus of you. Nothing that we're conveying in this webinar has been crafted in a vacuum. I think that's important for you to know. There are leaders and colleagues who are literally working around the clock to create the very best possible circumstances, to promulgate the very best messaging, to orchestrate the very best delivery, and to ensure the best possible outcomes for our FIU community are in place. Now, with over 10,000 employees and over 56,000 students, you have to know that there's not a one-size-fits-all. So we're doing everything that we can do to be thoughtful, to be mindful, to think of all the possible scenarios. You've been extremely helpful to us in that, as you've been asking questions and even forcing us to think about things that we hadn't thought about before. So be assured that we did not hesitate to have safety and the well-being of our faculty, staff, and students in mind as we're preparing commentary for you. And guess what? We're not hesitating now. We're consistently being mindful of those important things. So as a reminder today, we're going to be answering questions. We're going to be over communicating on some recurring themes and things you've been asking about as relates to vaccines and office space and presence and childcare. And I have some new information that I want to share with you today. We are continuing to implement a progressive repopulation plan. Last week, we announced that we needed everyone to be on campus at minimum 3 times per week, okay? Because everybody's already engaged in rotation, but at minimum, your physical presence on campus 3 times per week. We're going to amp that up a little bit. On yesterday, we met with all of our senior leaders, all of our BU heads, all of our vice presidents, all of our deans. And effective Monday, all of our BU heads, all of our leaders and the deans will be joining me here 5 days a week on campus, working on site. On March 1st, we're asking all of our community with offices, if you have an office, we're asking you to join us on March 1st and begin working every day on campus. We will continue with those instances and areas that have that work in open spaces or work in cubicles and such. Those will continue the 3-day presence on site and continue ensuring that we have 6 feet physical distancing. That has not changed in any instance. We want 6 feet physical distancing in those open spaces. I think that's very important information to lay out in the beginning. So if you have questions around that, we are prepared to answer those questions. So we're going to jump in and get started with some of the questions that have come to us. And I'm going to ask my colleagues to be prepared to respond. I'm going to start with a question that has to do with open space, okay? And the question is, how an office with many employees and no separate spacing should handle an open floor plan that already presented issues with initial repopulation efforts, okay? How can offices of this kind of situation ensure safety while increasing repopulation efforts? And I'm going to pose that question to our Space Management Director, Gloria Giacomino, and then ask our Assistant Vice President, Carlos Flores, to weigh in as it relates to rotation. So Gloria, could you speak to that, how individuals with open spaces or without separate spacing should handle repopulation efforts?
Okay, sure. Thank you, Elpanye. So the way that we had discussed before, and we will continue with the same thinking, is that we want to use every other cubicle, and if the cubicles are back to back or any kind of linear layout, then we want to use a zigzag pattern, so that while you're sitting in your cubicle, the cubicle around you will not be used at the same time, and to establish a rotation process by which we can do that. The most important thing is to maintain that 6-foot social distancing or physical distancing and to wear our masks at all times. But that would be the way to accomplish that, to do every other cubicle in a zigzag pattern, and the whole group to be on a rotation pattern that would allow that.
Thank you, Gloria. And Carlos, would you speak a little bit to how rotations can be affected by supervisors or support assistants?
Absolutely, and thank you very much, and good morning, everyone. I think the main point here is maximize the use of our space, right? And as Gloria commented, is giving you recommendations as far as pattern and utilization. But please keep in mind that open spaces will continue to use rotations, adhering to physical distancing guidelines, right? So we have been rotating for a while now. We just ask you could, in an open space, to continue to use that the way you've been doing it. If there's an opportunity to increase occupancy and continue to physical distance, then do so. That's the ask. And again, just to reiterate, private offices can be used 5 days a week.
Thank you. Here's a question about air filtration systems. Can you tell us more? I'm posing this to John Cal. Can you tell us more about the air filtration system in the PC building, specifically the 4th floor, and whether occupants need to be concerned about the filtration of the air in that location, and does it warrant purchasing a filtration device? John, can you help us with that one?
I can sure try.
Okay.
So what we have learned through this whole process is air filtration is key. While we have found no silver bullets, we have made modifications and improvements to various systems throughout campus. One generalized improvement we've made, we previously used predominantly MERV 8, MERV 9 commercial filters, which met the original design of the buildings and of the equipment, but we wanted to see whether we could improve it. So we moved to MERV 13, tested it on our equipment, and made the assessment that the equipment could continue to function properly even with that higher level of filtration. So we have moved to installing MERV 13 filters throughout campus. The only place where we still have where we will ultimately have MERV 8 or MERV 9 is when they are used in series with a MERV 13 filter. So there is still MERV 13 filtration, but in some of our buildings, they're in series, but they'll be used in conjunction with each other. Right now, about 60% of our buildings have the MERV 13 filters. We have ordered them. That is an additional expense. We've absorbed that expense. The supply chain, though, has been hit hard. And so while all these deliveries were supposed to arrive in November and December, we are still waiting on some of them. Specific to, we have about 60 to 65% of the buildings have been retrofitted with the MERV 13 filters. We expect 30% by the end of this, another 30% by the end of this month, and the remaining 5% is projected for early April. In the case of the PC, which is the specific question that you raised, those MERV 13 filters have already been installed. So they have that higher filtration. Now that filtration will help, but given the extremely small size of the coronavirus particle, I'll call it that, and I'm sure the scientists have a better name for it, but the diameter of that cell is about 1 micron. A MERV 13 only protects down to 3 to 5 microns. Now, the coronavirus cell may not be floating by itself. It may be with something else, and it may get caught. But again, it's a higher filtration, but there's no guarantee. The question asks about HEPA filters. We do know that HEPA filters, when integrated into the HVAC system itself, are highly effective. What is less known, HEPA filters are not widely used. They're used primarily in laboratory clean rooms, hospital operating rooms, but not elsewhere. Certainly not in commercial office space, not in classroom space. They're not residential. They're very special use, extremely expensive, and really don't warrant that generalized application. As an example, there are no HEPA filters at FIU, and there is no easy way to retrofit any system with a HEPA filter. Now, the trend has been towards personal or portable HEPA devices. We use some of those in some cases where we are doing mold remediation. But again, that is a very specialized use. So if someone brings a HEPA filter, a portable HEPA filter, the personal or the desktop, there are a number of varieties. We are not aware of any current literature or study that definitively says, speaks to its effectiveness. Generally speaking, yes, it should help, but we can't tell you that that it has the same effectiveness as a HEPA filter that's integrated into the HVAC system. Uh, we would not prohibit someone from bringing that portable device in if they want to do so, but that's an individual choice. The individual would do that at um, their own expense, and the maintenance that would have to be done on that HEPA filter or HEPA device, including changing the filter, would really belong to the individual. So we neither encourage nor discourage. And at this point, we have not seen the literature that gives a definitive judgment on how effective it might be. I know it gives people a lot of psychological comfort. So again, if someone brings that in, it's not like bringing in a heater. It doesn't expend that much energy. Um, that would be okay. But even the CDC guidance, and even the CDC guidance, limits portable filters to the locations that really need it. And if you look at that guidance, and I think we've put that in the FAQs, it doesn't speak about using it for generalized office use. Um, to answer the specific question about the PC fourth floor, to our knowledge, we think that is good indoor air quality. We have no reason to think it's not. If somebody has a specific concern, you can get a second opinion from EH&S. EH&S will look at that space, make an assessment, and then work with us if it needs further investigation or mitigation.
Thank you so much, John. That really does create an even greater level of comfort. I know that you all are doing an amazing job, so I appreciate that. Let me switch over to Alberto of our police department and Sanyo of the GC. I have a question here, and this is one of those recurring ones. On my walk, I was walking across campus and I saw approximately 8 people not wearing masks. About 3 more not properly wearing masks. None of these people were actively eating or drinking, nor were they sitting at a table where one could assume they had just finished eating or drinking. Since FIU requires everyone to wear masks at all times, what steps is FIU taking to ensure that those on campus are truly following instructions? Alberto, let me come to you first. If you would share with our listeners a response to that, we'd appreciate it.
Yeah, good morning, and great question. So we have increased our foot patrol in the most common areas, the Grand Center and the Green Library, and we have equipped our officers with additional masks. So if we encounter someone without a mask, we ask them they might have a mask already, so we tell them to please put on the mask. There's a policy within FIU. And if they don't have a mask, then our officers are equipped, like I said, with additional masks, and we'll give them one. Not only our officers, but also our police service technicians. And we encourage anyone that might see someone not following the rules and regulations to call our dispatch, and we'll definitely dispatch a unit, and we will make contact with those individuals.
Thank you. Thank you so much. And I'll tell you, as a personal experience, when I've had instances where I've seen individuals and I've walked up to them, and when we're walking across campus, we all look like students, right?
Right.
They've been very receptive. People have been very receptive, whether they've been students or colleagues, whatever. They've been very receptive, not ever to be combative, but just a reminder, right? And people are normally receptive of that. Thank you so much, Alberto. Let me ask a question of you, Carlos. An individual is asking, how many hours should we be coming to the office? We were doing we would come into the office for 4 hours and then doing the rest from home. How many hours do we need to now repopulate? You can respond to that, Carlos.
Thank you, Opanye. So, it depends because, or is your standard hours 40 hours a week or 20 hours a week? So I think that's a factor that you need to take into account, but it has to be a practical response. And what I mean by that is, and again, the experience from our personal experience from HR is we encountered this as well. You have to factor in productivity, right? So if you're doing 4-day work days or 4-hour work days, that is a full commute, right? And it would impact productivity if I commute for 4 hours or I commute for 8 hours. So it depends. It may be the circumstances that it might be more convenient or necessary. So your department head might be in a better situation to determine the frequency for the week or hours for the day. But again, one of the things that we do ask you to take into consideration is that if you have to commute here, I think it's a little bit more practical to stay the entire day than just half a day. However, I have spoken to different areas where the rotation and the space lends itself to that type of rotation. So it's really depends on a scenario, but do factor in productivity and the commute as far as, how many hours you would be on campus. Preferably is 8, but there may be circumstances where 4 may be needed.
Thank you, Carlos. And that brings up a good point because offices and spaces throughout campus are configured differently. And so optimal for us is to make sure that everyone is safe and physical distancing needs to be top of mind. So thank you so much for that. Aneda, I have a question for you. This one is one that we've seen probably written 75 different ways. But this question, excuse me, has to do with the virus. With all these new variants of the virus appearing, is it
Yes,
really a good idea for the repopulation of the campus? If you could respond to that, we'd appreciate it.
sure, absolutely, EK. Thank you so much for your question and good morning, everyone. As we can say, we can't wait to welcome you all back. And yes, there's a lot of information, and we understand that there's been a lot of literature on the UK variant as well as the South African variant. And we also understand that Florida has been identified as one of the states with one of the highest numbers of the UK variant. However, we do not do anything differently, except as we know, the CDC guidelines lately have told us that with the two variants, because of the 35 to 50% more contagious, which means more rapidly transmitted, they are urging us to wear a double mask. And a double mask basically means 3 layers, which could be a combination of a surgical mask, which is the paper mask, as well as a cloth mask. However, we continue to follow all the preventive measures that we are all aware, which is what we can control and how best we can keep ourselves and others safe from the virus. I hope that answers your question.
Thank you. I'm sure I'll be coming back to you. So we're all hearing, come back. We welcome you back. We expect you back 3 days a week. We expect you back 5 days a week. Come back. So this is a great question for you, Roger, because the writer is asking if the offices are occupied more of the week. When will the deliveries be back to the individual buildings, such as Office Depot, Amazon, et cetera? Could you respond to that for us?
Yeah, sure, EK, thank you. I don't have a lot of information on that, so we're going to get back to you and communicate that to you as a community. But what I can tell you is when all the offices are completely 100% open, deliveries will resume from these third-party entities like Office Depot and Amazon and things like that. But again, look for future communications from the Office of Business and Finance on that, and we will keep you up to date to the minute.
Thank you. Thank you so much. We'll make sure to get that information out in real time when we get it. Thank you so much, Roger. And Nate, I'm going to come back to you because this question has to do with when we will be able to get more vaccines. When will they be available to more than just the population that's receiving them now? So Nate, if you could respond to that, we'd appreciate it.
Absolutely. First of all, we wish that we as FIU would be able to be recipients of more vaccines. However, there has been no inclination of that because there is a plan of what I call decentralization of point of distribution, which means that the plan right now is to open more access, which is the access point, and that means that these vaccines will be able to will go to places like CVS, Walmart, Walgreens, Publix, etc. In fact, in the state of Florida already, Central and North Florida already have vaccines at those sites. The other side of the vaccine, as you well know, EK, is the expansion of the criteria. As you know, we're still under the governor's executive order that basically the number one individuals are those with long-term care. Second would be 65 and older. Third, then would be the healthcare workers, which is interesting because the healthcare workers are in that environment, which is a high exposure according to the OSHA rules. And those are the areas, as John alluded to, that will have the HEPA filter. And yet they're really on the third line. Hopefully, and the next one would be those that are under 65 that have comorbid conditions. So we hope, and those of you that have been following this, you know that even community partners such as our public health system are even thinking already of expanding under 65 and over. So we hope within the next few weeks, two good things hopefully will happen. Number one, that we will have more access to vaccines at a decentralized aspect, which means at your local CVS, Walgreens, and others. And second, J&J would probably be announcing very soon their vaccine to be approved by EUA, which means the emergency authorization approval. So those are good things that we have to look forward to. So hopefully very, very soon, we will have more of our population vaccinated.
That's a good point. Thank you so much, Anita. Quick question, and maybe, I'm not sure if you even have an answer to this, but should J&J release their that new vaccine, would the conditions for distribution be the same? They would still fall under the governor's orders, correct, until that changed, right?
Correct. They would be the same. It's just the same that we are currently following right now with Pfizer and Moderna. So this would be just again a third vaccine that would be part of the tool chest, so to speak. So because of the production, there will be more vaccines available.
Gotcha. Thank you. Thank you so much. I'm sure people are really happy to hear that possibility of J&J being releasing their vaccine. So as we're talking about shifting schedules and bringing everyone back on campus, one of the other central themes, very important, that we are getting has to do with childcare. Carlos, one writer is asking, what if I can't go to work as I have childcare constraints? Could you talk to us about the childcare provisions, maybe some scenarios around childcare constraints and how we can address those?
Sure, absolutely. So there's different circumstances, and I'm going to go through different ones and explain how to handle each one, and we will communicate this in writing. So the first one is if the school is closed or space is not available for your child or children, and your role can be accomplished by remote work arrangements, the employee will be allowed to work remotely with the evidence of school closure. And that would be a combination of conversations with your supervisor or department head and our Office of Employee and Labor Relations that can be contacted at elr@fiu.edu. Circumstance number two would be if an employee's role cannot be accomplished by a work from home arrangement, but the child care it's an issue, just as circumstance number one, employee may be eligible to take leave under the COVID-19 emergency policy. And please keep in mind, if you do take leave, an employee either taking sick or vacation is not required to perform their work duties while taking leave. And in order to assist you with that, you can contact our benefits department at hrleaves fiu.edu. Circumstance number 3. If an employee chooses not to send their child or children, to school that is available to them, the employee will be required to seek alternative childcare or participate in rotations or use vacation leave. Vacation leave may be denied if it impacts work productivity. And again, an employee on leave, sick or vacation is not to perform work duties. And again, that is a conversation with your supervisor, department head, and the Office of Employee and Labor Relations is here to assist you. And again, can be contacted at elr@fiu.edu. Circumstance number 4, if an employee's child is attending school and is forced to quarantine, and we've had, a couple of instances of that. If the employee can work remotely, then the employee qualifies and should be permitted to work remotely during the quarantine. As an alternative, the employee may request leave under the COVID-19 emergency policy. And again, the employee on leave, sick or vacation is not to perform work duties while reporting leave. And again, contact our benefit departments at hrleaves@fiu.edu. Circumstance number 5 would be generally family household needs outside of childcare are not covered by the COVID-19 emergency policy and will require approved vacation and/or sick leave use. For special circumstances other than childcare, the employee should communicate those needs to the supervisor. And again, our Office of Employee and Labor Relations is here to assist. And circumstance number 6 is if an employee has a medical condition and would like to continue to work remotely, the employee should contact Inclusion, Diversity, Equity, and Access Office, which is IDEA, to inquire if they're eligible for an accommodation. And again, this is not new. There's another question about the UFF attestation. All that is being honored until the end of the semester. If you currently have an ADA accommodation through the Office of IDEA, those are also being honored until the end of the semester. This is, if new circumstances arise, these would be the different scenarios and how you would go about in handling, a combination of these scenarios should cover just about every scenario we have seen with our community.
Thank you. Thank you so much, Carlos. I want to pause for a moment and repeat the March 1st increase in frequency. You will recall last week, we increased frequency to on-site presence, working on-site at minimum 3 days a week, okay? On Monday, and now this is rotations, okay? This is rotations to the extent that your rotation has you physically working on campus 3 days a week, making sure that you can physically distance. That's everyone with an office, without an office, everyone at minimum should be working on site 3 days a week. Beginning on Monday, our senior leaders, our BU heads, all having offices, will be working physically on site 5 days a week. All right. So that's not a rotation. That's maximum presence on campus with offices. Okay. On March 1st, those with offices, in addition to our BU heads and our senior leaders with offices, will be working on site 5 days per week. Individuals who do not have offices will continue with their 3-day presence on campus, on site, making sure that they're able to physically distance in their spaces. So if you work in an area where there are cubicles, right, you would work on site 3 days a week, making sure that on the days that you're here, the others that work in their cubicles are physically distanced from you 6 feet and facing in the direction that Gloria had mentioned earlier, that everyone should be facing in the same direction. All those types of things you would do within your own purview, having presence on campus. But if you have office space, if you have office real estate on our beautiful FIU campuses, your expectation as of March 1st is that you will be on campus daily. Okay, so I want to pose a question to our provost. And the question that's been asked is, when you mean all employees go to campus 5 days a week, are you including faculty that have offices? And if not, why are they being treated differently? Many staff are asking. And I know that Carlos alluded earlier to the attestation, but Mr. Provost, if you would please respond to that, I'd appreciate it.
Yes, I'm happy to. So as you mentioned, the faculty through their union have a attestation process for this semester at least. So that's one consideration. But I think the first answer is yes. When we say employees, we want everyone back in their offices on a daily basis. We also want the students, in the classes that are they're registered for their in-person classes to come on campus. With faculty, the difference is that many of the faculty have research assignments, which are typically about 50% of their assignment, and that may not involve working in their office. And so, that varies considerably from faculty to faculty. And also many faculty are teaching, they're not teaching normal 9 to 5 hours. They're teaching evening classes, weekend classes, or they've been teaching fully online, even before COVID-19. So as Carlos mentioned, it's the big consideration here, of course, is a practical response, make sure we can maintain productivity, and we will honor all the attestations for this semester. And as and just like it is with your department head, for the faculty, it's your department chair that you need to be working with.
Thank you so much, Mr. Provost. I'm going to shift because there are some people like myself that are excited about food, okay? So Roger, if you would help us with this question. The writer says, are you all planning on opening all dining and retail facilities with all of us coming back? How do you plan on cleaning public spaces, doorways, etc., with all of us back? Excuse me. Roger, if you could begin with that, and then maybe I can shift over to John to assist with the cleaning of the public spaces.
Yeah, absolutely. Thank you, VP Hudson, for the question. And I've seen a number of these questions in the Q&A. So rather than typing a response, I'm glad I get to answer live. First of all, let me start by saying that we at Shop FIU appreciate the staff at Panther Dining for being on campus, feeding the faculty, staff, and students that have been living and working on campus since last March. They never shut down. Many of these dedicated employees never left, and they've been working daily to serve our community. Over the past year, our dining locations have gradually reopened to serve the growing population on campus. Right now, there are about a dozen dining and convenience store locations open at MMC and BBC. We've intentionally worked with our local restaurant owners and our business partners, such as Crepe King, Sushi Maki, Almazar, Tropical Smoothie. These are business owners locally in Miami in the restaurant industry that have been one of the hardest hit during this pandemic. We ask that you support these dining locations so they can continue to help serve our community. In addition, we continue to offer mobile ordering through our Grubhub app, so you can limit your time indoors and waiting in line. Over the last few weeks and continuing on through our repopulation, we're monitoring on-campus traffic, and we're working closely with our dining partner to evaluate the reopening of additional dining venues. So far, we've expanded hours of operation in many venues, and we've added additional stations and additional menu items and promotions at 8th Street Campus Kitchen in the Graham Center. Now, because most of these restaurants and venues have been closed for almost a year, each restaurant's going to have to be reopened from scratch. That includes hiring, training, ordering, and multiple other functions. So look for a varied reopening based on brand requirements throughout this process. As locations are scheduled to be reopened, we will communicate these to the FIU community. I want to thank those who filled out our Shop FIU survey this semester. One of our questions is, what do you want to see open first? Your voice helps us bring you the services and the venues that you want and that you need. For more information on what's open, on current hours of operation, please visit shop.fiu.edu. To provide feedback, always use our Shop Listens questionnaire. That's on our website, and that's located at every one of our venues. And then from a cleanliness standpoint, we worked with our retail partners and our dining partners who submitted detailed repopulation standards and guides that were approved by FIU. And they are diligent on cleaning, on the social distancing piece, and on the protection of the locations. So not only are we looking at facilities, but our partners and our business partners through the Office of Business Services are focused on the cleanliness, the safety, and the sanitation of the FIU community. But I know that John can probably elaborate on that.
Thank you. Thank you so much, Roger. John, would you please elaborate?
I'll try. Can you see me?
Yes.
Hey,
Beautifully.
flattery. So as you know, our custodial forces are staffed for a fully occupied campus. We have not laid anyone off. We have not reduced our staff at all. I think that's also the case for housing and for the student and the student centers have ramped back up. So our staff has been here. They are cleaning. The emphasis has been on the public common areas, high traffic, high touch areas. One thing I would add that what we've learned over this 10 months, we continue to clean and clean intensively. We got additional disinfectant machines. We purchased Clorox Total 360, which we affectionately call the Ghostbusters, and we use them extensively. What the scientific literature has indicated, and I'm sure you've seen some of this in the press, mainstream media, thus far, there seems to be no indication or very little indication. In fact, I'll say no indication of infection from a surface touch. That was a fear at the start of the pandemic. That is still, I think, theoretically possible, but we have not seen that kind of outbreak. So that doesn't mean we're going to stop cleaning. We continue to clean, but I think overall we should focus or be less afraid of surfaces and more focused on our person-to-person contact, which does seem to be where the disease gets spread. With that said, we are not reducing any kind of cleaning. There are benefits to cleaning well beyond just coronavirus. We do know there are other viruses, there are other germs, and cleaning gives us a better environment, protects us from those other sicknesses. And we all know that a clean environment is a better place to work and has an impact on how we work. So our custodial force has really stepped up. They've done an outstanding job, never left. And you talk about a group, and I give great credit to the custodial supervisors throughout the campus, not just facilities, but housing and the student centers. They've adhered to the protocol. And by adhering to the protocol, even as they work, they have proved that the protocols can work. You will find our custodians all wear the mask. In fact, their question to us sometimes is, why aren't all the students wearing the mask? And so we have to deal with that, but you can be assured that our custodians will observe the protocols and they will clean, and they are cleaning aggressively with a focus on the common areas and the high touch areas. Additionally, when the pandemic started, we had a work group in the campus repopulation task force that focused on personal protective equipment and masks. So we have had two issues at the beginning of each semester to all employees of what we call the care package. And in that care package, you received 2 face masks, cloth face masks, which are high quality and very effective. They went through a competitive selection process where the doctors and the health professionals made the final choice. It was not based on price, it was based on quality. And then we negotiated price. You got disinfectant and towels and hand sanitizer as well. So if you are concerned about your individual workspace, you have the tools to clean those. We cannot clean your individual area daily. We're focused on the common areas, but you have the tools to take care of those areas that you touch. Finally, as we bring everyone else back, we do have a contingency plan. If we need additional cleaning, we have negotiated a contract or a proposed arrangement with an outside provider if we need to surge our ability to clean and disinfect. That is in place, and we can activate it as needed. We did the outsourced negotiated arrangement because if we needed to surge from internal organic forces, we might not be able to do that given the limitations of the hiring process and the time that takes. So again, if as we repopulate, we find that we can't keep up with the demand and the traffic, we have a contingency to bring in an outsourced provider to also supplement our efforts. Hopefully, Panye, I've answered that question.
Thoroughly, John. And I just want to echo, this is a like a commercial, right? So you see this P3, we all have our P3. P3 is not just our app, it is truly Panthers protecting Panthers. So I love what you said about we were given the tools, right, to sanitize, to keep our own spaces clean and clear. So please, please, please take advantage of the resources that have been provided. So thank you. You were very, very clear, very thorough. Thank you. I want to pivot over to Sanyo because this is another kind of recurring theme, and I'm going to ask you to elaborate particularly about our ambassadors. But here's the question. I see students, employees, and contractors every time I'm on campus not wearing masks. Most of the time they put on masks when you ask. If they don't, you call the police, but the police will get there after the student has moved on. There is no consequence for not wearing masks, so the students don't if they don't want to. So Sanyo, if you would talk to us about the role of our ambassadors, I think that's very important for the community to know that that's in place and is ramping up certainly as we're repopulating. Would you share on that, please?
Absolutely. Thank you, EK. And thank you for the question. I appreciate the opportunity to speak to you all. Again, good morning, Panther family. My name is Sanyo. One of my roles is to oversee the P3 Ambassador Program. The P3 Ambassadors, who are they? These are student employees who we have hired and trained to walk around our campuses, predominantly MMC, BBC, and our engineering center. They cover our campuses 5 days a week. And of course, they're trying to make sure that all on-campus population, everyone is adhering to face coverings on correctly and also social distance and physical distancing. Now, with that said, I appreciate the question, and the person says, even after saying something, sometimes the face covering may come off. First of all, I want to urge every single person here to continue doing that for us, because the ambassadors, as many as we may have, there's no way we can cover our entire footprint. We have large campuses. And so I urge you to please, if you see something, say something. Now, it may be disheartening to see that they put it on, but please, let's not stop the message. The narrative must continue because we're all safer when we're doing this together. And in case you feel uncomfortable, honestly, a lot of times all it takes is nonverbal communication. You could just maybe point towards the face area and the message is conveyed. And most often than not, people put their masks on. In case you feel uncomfortable having that conversation with our students or anyone on campus, please look for our ambassadors. They are around and they are rocking these amazing polos, and as you can see, they're all branded with the P3 ambassador logo on them. So they're rocking these beautiful golden polos, jackets and hats, and they also have free face coverings or masks to provide in case somebody does not have one. So look out for them. They'll have that conversation for you. They've been trained to do so. And finally, I want to say, in case you don't see an ambassador around, again, please call the police. They're here to help as well. Now, the question that's the ambassador program. Now, I believe the question also touches on the consequence. I do want to share that there are consequences when we have an instance or recurring issue with any individuals. There is a process for us to follow. For students, it's following the conduct process through our student conduct and academic integrity. We work closely with the dean of students, with faculty and staff. It's leveraging HR. So we do have a process and consequence model that is established, and it is working. It is, unfortunately, it is something that we continue to leverage, but we definitely hope that we focus on education to make sure that everybody buys into this. My favorite message to convey to individuals is, for your safety and mine, please wear your mask properly. And most often than not, they get it. And together we can make our on-campus experience safer, and we stronger together. Thank you.
Thank you so much, Samuel. I think I should have one of those shirts because I love the bling. And so if I can get a nice bright gold shirt, I can help. Okay. Thank you so much. I'm going to pivot over to you, Tom, because again, we're excited about the presence that we have on campus. And I have a question here about whether the bus shuttle is running from MMC to BBC. Can you speak to that for us really quickly? Tom, are you on mute there? I can definitely come back to you because I have no shortage of vaccine questions. So get ready. I'll be back to you. Let me just switch over to Aneda. Aneda, I have a question here that you, I'm sure, will answer quite eloquently. The CDC is forecasting that the B.1.1.7 variant will become the predominant variant by March. What is the university's protocol for scaling back repopulation in the case of a potential surge in cases? Could you respond to that for us?
Absolutely. I think that the best testament to that is exactly what we did just a year ago, which is we did pivot and we did adapt to what then was a novel virus. And we were able to do it very, very quickly, very promptly. And still, as you know, the university really never closed, EK. And that's something that we really need to understand. You know, we had units that were here as always, and that includes the custodial, the clinical staff, et cetera. So I think we're ready. If we need to pivot back, we will be ready. But again, we do have more tools than we did in March. If you recall, we were even having challenges for testing. Now we have testing readily available, you know, across our campuses for free. We know a lot more of how this virus is transmitted. We now have the vaccines. So again, you know, if we need to pivot, we need to pivot. But guess what? We do have a lot of more tools in our tool chest. So we would be ready.
Awesome. Thank you. Thank you so much. And I could not agree more. I've been walking with us through this process and seeing the evolution of us not having information and still putting together a solid plan to the place where we are now, where we have so much more. But let me hold on to you while I have you and ask this question. Will FIU update the mask policy to reflect double masking due to CDC? And is the face shield a replacement for a mask?
Okay, that the question with the face shield obviously has been even from before when we were just concentrating on the one mask. No, it is best for you to wear the mask, whether it's a single mask as before or a double mask, unless you do have issues, you know, clinical medical issues, and then we would like, you know, if that is the case, then we would adjust. But that is really the rare, it's the outlier, not the usual. As far as the double masking, yes, I know that we are getting ready to have a campaign. and to be able to go out there and educate our public as to why we need to use it, because that is important, and the importance of using it. So that will be forthcoming. Yes.
Thank you. Thank you so much. I'm going to go over to hear from my colleague, Bobby. I just want to hear that voice. I want you all to hear that voice. Bobby, the question is, if we have a dentist appointment during the workday and we return to campus, do we need to complete the return to campus check-in again after returning from the appointment? Could you speak to that for us?
Yes, so good afternoon, everyone. Thank you for being on today. So the P3 app, what we've built the guidelines on is you actually do fill it out that one time a day. So if you actually do go to campus and you fill out the P3 app and you actually do leave campus and then come back, you only actually have to fill it out that one time. So thank you, EK.
Thank you so much. Carlos, I'm going to come back to you with a question that's on the minds and hearts of everyone, especially now. The question is, when is the flex working plan that's being developed expected to be communicated to the university community? And I know that you are a member of that strategic planning group, and several are working on that. But if you could just share a response for that, we'd appreciate it.
Thank you, Alpanye. So we are, that is part of our strategic plan. And the question keeps coming up. So this is something that, we are actively working on. There's committees, not only on the administrative side, but also on the faculty side. And, keep in mind that we are trying to be thoughtful, and not all roles lend themselves to that type of remote model. So we are working in trying to determine what is the best way to roll that out. Right now, we are, caught in between rolling that out and also trying to repopulate. So, keep in mind that our students and college experience includes learning and enrichment of and outside of the classroom, right? So we do need to, repopulate our campus as much as possible as it relates to our ecosystem. But we are working on that, and we will deploy that in conjunction with the repopulation. So, that is not going away. That is something that we have learned a lot from this experience as well. And we will incorporate some of the best practices that we have learned as a result of the pandemic in the rollout of that model. So it's not that, we can implement it immediately. We are working on it so that it could be rolled out in a thoughtful and a structured manner, taking advantage of the experience that we have based on the pandemic.
Thank you so very much, Carlos. Mr. Provost, I'd like to come back to you. I have a question around hybrid high flex courses. And the question is, what measures are being implemented to ensure hybrid high flex courses are actually meeting in the classrooms per the meeting dates scheduled into PantherSoft? If you could respond, that'd be great.
Yeah, happy to use. Yeah, so we actually have, we know all the courses that are students are scheduled in for those high flex courses. And so some of them meet, every single week, and some may have more meetings scheduled later in the semester. And so just like during a regular semester, the faculty are aware that, they are to teach those courses at the time that they are scheduled and be there in person. And if for some reason that changes, then we would ask the faculty, if they want to make a change, need to talk with their supervisor, their department chair, if there's some reason to do that. Hopefully that doesn't occur. And if the schedule changes, the students can also reach out to Ask Charlie, as you've heard in other events, just to, if there's a challenge in terms of the course not being available when it was intended to be scheduled in person.
Thank you. Thank you so much, Mr. Provost. And Nate, I'm going to ask you to come back. You're such a popular member of my team here today. So I actually have two questions, but I'm going to break it up. The first is, what are the steps if someone in our office tests positive or potentially exposed or has been potentially exposed to someone with COVID and are awaiting results? Will they be able to work remotely while awaiting test results. Let me stop there and have you respond to what one is to do if they test positive or are potentially exposed.
Well, first and foremost, I hope that that individual has done the P3. So it's not like they have just been in the office and heard that they have tested. And this is the reason why, if you feel that you have been exposed, whether symptomatic or asymptomatic, obviously you should be taking you should be going and taking a test. And I would recommend to wait because yes, what if it's positive and you go back to work? So again, if the question is, what if they just found out? My recommendation would have been, if you have taken a test, please stay home. And this is why we have to do the screening, which is a preventive measure. So again, we don't want to be able to work backwards, but work forward. So that would be my response to that. The other, as far as if that individual is positive or is waiting because they have been exposed to someone, and with the P3 and the guidance of the COVID response team, they can work remotely. Yes, they can. And that has been occurring. And as you know, it has worked well. But that is in the case of exposure and or even the individual being positive.
Excellent. And I
I
want
hope
to
that.
emphasize what Anita just said. It starts with that P3 and it works. I'm a witness. It works and it works like a charm. And the notifications go to every individual connected with you that needs to be aware. And you're absolutely comforted in knowing that we're able to trace. And so it does wonderful things. So that's a wonderful point. Thank you so much. So here's the next question I want to take you to. They would like to know, this has to do with the safety of staff as it relates to repopulation. The answers in the chats are listing the governor's orders for the vaccination priority, and that the campus feels that we can be safe if everyone follows CDC guidelines. However, from questions in the chat, it's clear that no one is feeling like those guidelines are being followed by everyone on campus, and this is causing anxiety for individuals. So this has to do with the vaccine, the priority order that the governor has put in place, right? And us feeling safe being on campus.
I think, let me just kind of try to tackle that question, but I think that the question is that if we do not have vaccines available, because possibly either the supply is not there and or the employee, it is not part of the current groups of the governor's executive order, and then they're concerned because individuals may not be following the preventive measures that we all know is really the key to prevention rather than working backwards, as I stated. I think that the answer to that is it starts with personal responsibility. And the second is quoting what Sanjo just did, that although we do have ambassadors around, we are all ambassadors of FIU. So this is not leaving the responsibility to a group, but this is a collective action. And we have seen that even globally. If globally all scientists have not been working together, we wouldn't be here today. So I think that the message is that we are all in this together. So we are all ambassadors of FIU.
Thank you. Thank you so very much. And that we're Panthers protecting Panthers, okay? Carlos, I'm going to come back to you, and this is a two-part question that you can knock out at once. But the question is, now that all employees who have an office are expected to return to campus 5 days a week, allowing for more traffic among departments, how are open front desk reception areas being considered? I realize that protective dividers were installed. However, are these high traffic areas being considered as cubicles? Please need clarity on how often employees who sit in a front desk reception area need to come in. And then the second part of that is that do these guidelines apply to student employees? You have direct firsthand experience as having oversight of the service center. So if you could respond to that, that would be wonderful.
Yes, thank you, Opanye. So in reference to that question, the expectation, and that is, when we went back and looked at the workforce, we knew that 30% of our workforce, which is customer facing, student facing, would be impacted by this. So when you ask about, does this include our student employees? The question is, if we have an opportunity to bringing our entire workforce, including customer-facing areas, which should be open to our customers, the answer is yes. That includes that part of that workforce as well. In reference to, do they need to be there? Well, if you open your office, you need to have people who greet the people coming in, even if it's limited, traffic. One of the things that we did here is we are making appointments, right? We do have walk-ins and we will always have walk-ins, but we also encourage appointments to reduce the number of people that may be in a lobby at any given time. Now, from a front desk perspective, and we have experience, we were one of the first ones to pilot that, is we did install protective barriers, to protect, both individuals, not only the one in the reception area, but also the person, the individual visiting. So it is no different than the physical distance guidelines that we have. For example, in our front desk, we normally had 2 to 3 individuals working. We now are down to 1, and the other individuals are answering phones and are working in the other offices, and we do rotate in the front desk. But because of space limitations, we are not able to put more than 1 person at a time in our front desk. So it is no different than a cubicle. It is no different than what we are asking you to do in open spaces. Treat those very similar. The physical distance requirements are the same. And again, one of the things that we have done is we have rotated individuals, but we are limited by the square footage we have and the guidelines that we have in place on the amount of individuals or the number of individuals that can sit at the front desk at any given time. So again, we encourage you to, open your office. If you don't have the barriers installed, which was one of the initiatives that happened many months ago, we encourage you to reach out to facilities to do that. But we have been very successful. We have walk-ins pretty much every day, and we have implemented the appointment approach to minimize traffic. But we, at the end of the day, are restricted by the physical space we have. And that should be the determining factor to determine how many people can sit there at any given time.
Thank you so much, Carlos. And I'll just add that those that are visiting are happy to have us here. They're happy to be received when they do come. So thank you so much. I want to pivot over to John. This is the question. Will bathrooms have a higher frequency of cleaning shifts? Even with low occupation, I see sometimes bathrooms that are not clean. I can only imagine these areas becoming hotspots to increase cleaning efforts. John, could you speak to that for us?
Of course. Our intent right now is to clean every restroom at least twice per day. We monitor the activity so that if they need more frequent cleaning, we can adjust and increase that. If there is a specific concern of a restroom, feel free to call work management. That's extension 74600, and tell us which restroom you think isn't up to snuff, and we will address that. We do have, so we are watching the restrooms and the activity level. But if you see something that we've missed, we'll certainly react to that. So again, you can call 74600.
Thank you, John. We appreciate that. I'm going to ask Tom if you would come back, Tom, and talk with us about transportation between campuses. There was a question earlier about when would the buses be moving from MMC to BBC. If you could speak about transportation generally, that would be wonderful.
Certainly, EK, and thank you for the question and the opportunity to speak on this. GPE currently runs from 6 a.m. to 10 p.m. between the two campuses at BBC and MMC every 30 minutes at the top and bottom of the hour, with the last departure at 11 p.m. And that can be tracked on the FIU mobile app to see where the bus is and when the next one will actually arrive at that location. But they do depart every 30 minutes from 6 a.m. to 10 p.m., last departure at 11. We also have Panther movers currently running at MMC around the Perimeter Road, University Drive, and those are from 8 a.m. to 8 p.m. Freebie also, which is a third-party vendor, but they offer transportation services to our students to get to campus and from campus in a 2.5 to 3 mile radius of our campus. And those are available on the Freebie app. It's a on-demand pickup service. So our students, staff, faculty, anybody can use the service to come to campus or to go back home if you live close by.
Awesome. That's great news. That's great news. Thank you so much, Tom. I'm going to ask this question of you, Roger, if you can assist with this. The question is, will the university be providing CDC approved face masks?
Yeah, thank you for the question. I know 2 CDC approved face masks were provided to all employees in their repopulation package, so to speak. And I know someone else on the panel could probably speak to that. In addition, we have got CDC approved face coverings in the Pharma Box locations, both at MMC and BBC campus. So if you want a double mask, which I know has been advised, you can purchase some of the disposable or other masks from the Pharma Box locations. Barnes & Noble has CDC approved face coverings and masks logoed for FIU. And I know I've seen a lot of Panther Pride out there on the masks. So those are available as well. So, you know, I hope that answers the question, but we've got plenty of options for you.
It answers it beautifully. Thank you. And I personally have purchased my mask off campus because I like the bling. So I'll have a paper underneath and a cover outside. So join me in that. Carlos, I'm going to ask you to help me with this question. Can someone please clarify in simple words and numbers exactly who, when, and how many days each employee category should go to campus? And so I'm asking you to do that for me because they said in simple words, so I think I might not have been as simple as I could have been. So please help me, Carlos, in responding to that question.
Thank you. So the intent here is to repopulate the campus as much as possible in a safe manner, right? So when we spoke about 100% rotation participation, we have been doing that for months, and this is a continuation of our efforts. What we're asking you now is let's maximize the use of our space. And in order to do that safely, we are targeting our office space, and the open space I don't think is going to change considerably if you were doing the rotations before, right? So again, from an open space perspective, if you are rotating at maximum capacity based on the physical distancing requirements, then you are expected to continue to do the same, right? In some cases, we would like more participation of the rotation, and that will not change. What we are asking you now is to make more use of our space, specifically our offices, our private offices. So, we ask you again that open spaces will continue to do the rotations, but private offices should be used 5 days a week. I think that is going to assist in our repopulation efforts and is in line with our, our safety measures that we have in place. So this is something that, we've been talking about. We're just being a little bit more specific now and intentional. And again, the focus is to maximize as much space as we can in a safely manner. Specifically, all offices should be used because that is the safest space that we have. However, open spaces, again, adhering to the physical distancing guidelines, will continue to be in a rotation basis. So how many days? we're aiming, right? And you know, there was a question that I saw is we're going to 3 to 5, and you know, we will continue. Our job is to continue to raise the bar as much as we can in a safely manner. And our intent is to repopulate as much as we can, as quickly as we can, as safely as we can. And again, that is why the emphasis on private offices is what we're you know, recommending, to use all those spaces in order to assist us in this repopulation effort. So as far as El Peña, when you say in simple terms, you know, is rotations will continue. The use of private offices, we can certainly do a better job, and I think that is the intent. We want to get back to our previous state of the vibrant community that we have. And that is the ask. Let's use our space wisely, and that is a huge opportunity that I think we can do a better job in.
Thank you so much, Carlos. And I'll even go a little bit further to say uh, a normal work week is 40 hours. Now, well, a normal work week for most people is 40 hours. For us, it's about 60 hours, right? But we're saying your physical presence, your normal work week, 5 days per week, 40 hours per week, when you have physical office space. It's a privilege to have an office. That's prime real estate. And so we're simply saying return to your physical offices March 1st for your full 40-hour work week. And if you're working in cubicles, if you're working in open spaces, you must adhere to physical distancing guidelines, which will not permit everyone to come into that space at the same time. And so that's where rotations will continue at maximum ability, okay? And we'll continue to have that. One of the questions that came forward was, will we be releasing this information in writing from the Provost's Office, President's Office, Human Resources? The answer is yes. You will get this communication in writing concerning the 5-day presence for senior leaders on Monday and then the community on March 1st, okay? All righty, I have a question for you, Mr. Provost. And the question is, how will the repopulation plan affect access to the Green Library? And you may wish to speak to both libraries when we're talking about it.
Yeah, so for for both of our libraries at MMC and BBC, you know, we will continue to follow the same procedures in terms of you can reserve areas for study, and there'll be at the moment we as the number of people come on campus and it increases, we may look at different options, but at the moment we have capacity for people to utilize the libraries when they come on campus. And we will continue, as has been stated multiple times, with all of the CDC guidelines. So we still are going to maintain the 6-foot distancing, the regular disinfection. We're even adding in additional levels of screening and cleaning as the population increases. So there will be no change to all those measures that have allowed us to have a very low positivity rate on campus. Typically, we're well below 3%, often below 1% positivity on our campus because of all of these measures, and those will continue. So we just you'll find that more areas on campus will be available and hopefully utilized by the increased students on campus as well as faculty and staff.
Excellent, thank you. I'm not gonna let you go just yet. I got 2 more for you. Will you be requiring testing to return to campus?
Who's that for?
Yeah, that's for you, sir. Are we requiring testing? And we can tag team on this. Are we requiring testing to return to campus?
No, so the procedures remain as they have, which is that we are doing regular surveillance testing of populations, especially we dubbed them our close proximity Panthers. So students who are and faculty and staff that are working, say, in laboratories, then we're doing a screening of those individuals, those living in residence halls, those are athletes, as we've been doing on a regular basis. So there's required testing for those types of populations. And then we're primarily using our P3 app. So if a student or faculty or staff fails their P3 app, they will be contacted and then recommended to do their testing on campus. As was said, it's convenient. There's walk up on campus free of charge. And so beyond that, there's not an additional requirement of testing to be on campus.
Thank you, sir. And I would add that we're not requiring testing. However, we are strongly encouraging it. How awesome is it that right here on our property, we have access to testing? So we strongly encourage it. Listen, and there's no like, oh, you had one this week and you can't come back. It's there and it's available to us. And we encourage you strongly to take advantage of that resource as well. And then one more question for you, Mr. Provost. The question is, what are the protocols for staff meetings? Are we still to meet via Zoom, but in our offices? And we'd like for you to share your thoughts there.
Yeah, at the moment, most of our meetings, even those of us who have private offices, are still through Zoom. That typically is the safest approach. And but if you're in an area, people are free if they can be 6 feet apart and be wearing their face coverings. I know people are meeting outside, which is even safer than meeting indoors. So at the moment, we are continuing with most meetings that are continuing in Zoom so that we can minimize the interactions of people and keep the physical distancing occurring.
Thank you. Thank you so much. Oh my goodness, this time is getting away from us and we have so much to cover. Let me quickly pivot over to you, John. The question is, will buildings be open to work on the weekends, specifically the PC?
I think, yes, the answer to that is yes. But we would need to check if an individual has a specific concern, let us know who that, if they can let us know who that is, we'll check the status to ensure that they have access. But right now, access is available through the One Card.
Thank you. Thank you so much. I have a question for one of our amazing students I'd like to pose, who's with us today. The question is this: I'm curious about hearing from student representatives. Have we had webinars or town halls where we've invited members of student government to provide us with insight into their experience and their feelings about repopulation? And EK would say, I'm glad you asked. Alexandra, would you come and share your thoughts in response to that question?
Yes, good afternoon, everybody. Thank you, Mrs. Hudson, for having me today. I'm here on behalf of the Black Student Union, and I just want to say thank you to FIU for allowing us to slowly get into having more pickup events, having more things for our students on campus. I have seen it go from having 10 to 15 students come to pick up to having 65. And that to me is just great because I see that our community is loving the things that we're doing. I can also speak from as a student standpoint that I love to see my students with masks on, of course, and socially distanced, but I love to see them and I love to see them happy getting giveaways and getting stuff and just being able to have our community back together again, essentially. So, yes.
Thank you so much for those words. And we're happy to be here for you. And we appreciate you and what you're doing for the Black Student Union and all of our students. Thank you so much. Thank you so much. Mr. Provost, I'm going to come back to you in our last few minutes because this has been burning on the hearts of some of our inquirers. And the question is, if the majority of students are choosing to remain remote, at least anecdotally, this is what I'm hearing for the spring semester. I'm reading this verbatim. Why is the university not phasing in repopulation closer to the summer semester, which would give the CDC a chance to further assess the variant and potential surges? Inquiring minds, Mr. Provost, want to know. Could you respond to that for us?
Yes. Well, first of all, it's not anecdotal that the number of students are lower than we expected, because we have increased by about, I think, 172% the number of percentage of students, or fall last semester to this semester, the number of students who are registered for in-person classes, but we haven't seen a proportional increase in seeing them in the classes. Many are still joining remotely. So we will be rolling out a number of different initiatives to try to increase that number, because we want the students who registered for their in-person classes to come in person. The faculty are there teaching, and we'll welcome them. We have all the CDC guidelines are being followed. So there's 6 foot spacing. We're doing the disinfecting. We've got the P3 app. We're even running COVID detection dogs now, or will very soon, as an extra layer of screening. And so it is totally as safe as I think it can be based on the available science, and we're using every measure we can so that we're welcoming the students back into those classrooms. And we expect, and just to put it in proportion, last semester we had about 50% of our courses remote. This semester we have only about 23% of our courses remote. And this summer we're not planning on having any of our courses remote, or very few, depending on what we can fit into our existing classes. And we're going back to the more traditional, either face-to-face, what we call certified hybrid, which is at least 1 or 2 days a week, every week. Or of course you have available the fully online courses, the Quality Matters designed fully online courses that are available to the students. So that's sort of a long answer to the quick answer is it is, we have plenty of room for the students to come back into the classroom. We want them to come back, and the faculty want them to come back, and we're looking forward to seeing them.
Awesome. Thank you so much, Mr. Provost. Listen, we've had such a great time here responding to your questions. And if there are any ones that have not been answered, know that we're going to get to those, and we'll get those to you at a later time. I want to thank all of our panelists, all of you that have been answering questions on the chat behind the scenes. Our hats off to you. All over 1.2 thousand of you who've been on the line. Please help me welcome back our president. He's going to speak to you. And then I want you to hang in there, because we have an amazing video to show after he's given his concluding remarks. Thank you so much for your attention this afternoon. President Rosenberg, back to you.
Yes, thank you, Panye, and thank you to all of our resource individuals who have responded to the questions. There are a lot of questions. There are more questions in many ways than answers. And together we can find ways to get the answers that we need. I want to reassure you that the issue of student success, with or without a pandemic, is the top issue for us. And keeping students safe and keeping our professional staff safe and our faculty is equally important. Place matters. Place matters. And our goal, as we start to edge in to the latter part of this semester, is to finish strong FIU. Well, what does that mean? First of all, we have to follow the rules. We have to follow the rules. In fact, now we're looking at 2 masks rather than 1. Second of all, we need to remember that every student counts. Our students are counting on us to get it right. And I'm very proud of this team that has worked so hard to do that. And in particular, I want to thank our very able custodians for all of their diligence and their hard work over the weeks and months of this pandemic. Every student counts. We need to expect our students to come back. We want our students to come back. Our faculty understand, and our professional staff understand, that the FIU experience is best accomplished through building strong relationships, being on campus, having a campus presence, and that challenge really is ever present, but now more than ever. So many of you are working on thinking that through. And I want to thank our faculty for their understanding of that, and assure our faculty that we expect you, if you have indicated that you're going to be teaching on campus, that you indeed are on campus, providing the instruction, the mentoring, the coaching, the thoughtfulness that our students definitely count on. Let's work on this together. We can do this together to encourage our students to come back. Yeah, we have high expectations. Yes, Elpania Hudson mentioned that and Carlos mentioned that the bar is going up, but it is us who we have always raised the bar on ourselves. And so I want to challenge us to raise the bar on ourselves, to find a way to do better with the resources that we have. In many ways, that's what this conversation is about. And then finally, as this semester winds down, we're going to have some incredible celebrations for our students who are going to graduate. We're going to have some caravans, joyful caravans, and we are working hard on having a face-to-face series of graduations. Again, using CDC guidelines with the physical distancing, being very careful, but there could be nothing more important than ensuring that our students graduate timely and that they feel that their relationship with us has been a relationship with time well spent. So I want to thank you for your willingness to lean in. Yeah, there's a lot more questions that we got to answer. There's a lot more work that we have to do. I'd like to have a more agile response to you when you have questions. I understand that some of you would rather speak to a human voice, and we will work on that. Yes, we understand that we need to have more food establishments open. And I want to thank those establishments that have been open for what they have done. And we will work on that. And yes, we understand that we have to accelerate working with authorities, the opportunity for you to get your vaccinations. And we are working on that now as we speak. And I'm confident that before we know it, you're going to have that availability so that you can get the vaccinations in the same way that we have testing that is fully available to you day in and day out. And we hope that you and your families will take advantage of that testing. So I want to thank you. Finish strong, FIU. We can do this. Thank you very much.
We're ready to prepare you to become industry leaders.
We're ready to keep campus sanitized for you.
We're ready to welcome you back. We're ready to connect you to the latest resources.
We're ready to fuel your coffee break.
We're ready to host your physically distanced events.
We're ready to cook your favorites.
We're here to help you meet your fitness and wellness goals.
We're ready to welcome you back.
Thank you all again so much for joining us this afternoon. Hope you have a fabulous Friday and a wonderful weekend ahead. Have a great day.